Hello, I'm Sunil V, Director of Interventional Cardiology at NYU Langone Health System, and I want to talk to you a little bit about the personal perspective on the 2025 Acute Coronary Syndrome Guidelines document, for which I was the first author. I had the privilege of writing about my experience in JACC, and I want to thank Dr. Krumholtz, the editor-in-chief, for allowing me to express my personal experience with leading a guidelines document. Leading the guidelines was really a privilege, and it really was a team effort. There's an entire process around how guidelines are developed. There's a surveillance process for when a guideline needs to be updated, and that schedule is usually every 2 years or so for guidelines documents. The current ACS guideline document really represents the first update in over 10 years. And because the body of evidence evolved so quickly, it really was time to update the ACS guidelines. Now, I'm not going to go through what the actual guidelines included, but what I will talk to you a little bit about is my personal experience as the chair of that guidelines committee. We had a lot of decisions that we had to make in order to make sure that this guideline was both digestible and contemporary with respect to the evidence that it presented. So first of all, we had to talk about the scope of the guidelines. As everyone knows, the definition of myocardial infarction involves several different types of acute MI. We decided as a writing group to limit it just to type 1 MI that's due to plaque rupture for several reasons. The first is that multiple randomized trials included patients with presumed type 1 myocardial infarction. And so really the body of evidence is to support that type of myocardial infarction. We mention other types of myocardial infarction, such as that due to SCAD, type 2 myocardial infarction, but really the evidence that underlies this particular guidelines document is really around type 1 myocardial infarction. The second challenge that we had was that because the evidence evolved so quickly, we had to set some kind of a cutoff regarding the types of evidence and the levels of evidence that we would actually incorporate into the guidelines. And this was very, very challenging because the 14-month process that it took to write these guidelines, there were multiple conferences, numerous simultaneous publications, but we had to come up with some kind of line in the sand because that evidence that we were considering requires discussion, it requires writing, and it requires peer review. During that process, of course, there's a lot of close calls, and we had to come to a consensus. Generally, the writing committee was pretty closely aligned on most of these recommendations, but there were a few recommendations on which the group was split. We had a formal voting process for specific guideline document recommendations. So, for example, if it was between 2A and 2B, we had a formal online voting, and if it was close, then we discussed it and tried to come to a consensus on what that recommendation would be. Finally, one of the bigger challenges was meeting deadlines. As I mentioned, this process took 14 months. We did bring the document to completion on time, but it required a lot of work. This was weekly calls, 2 to 4 hours of dedicated calls for myself, my vice chairs, Dr. Mark Rule and Dr. Michelle O'Donoghue, as well as hour-long calls for every single member of the writing committee. We're all very busy. We're all clinicians. We have to balance other parts of our lives in addition to writing for the guidelines. But I have to say the writing committee did a really, really good job of making sure that their sections were written, that we discussed those sections on time according to the schedule that was set forward, and everyone participated in developing the final guidelines recommendations. I'm really indebted to the writing committee for bringing this document in on deadline, and I'm particularly indebted to my vice chairs, Michelle O'Donoghue and Mark Rule, who really were extremely diligent in their review of the different sections, in helping to develop consensus, and really for their meticulous nature reviewing the final document. So it was really a very, very rewarding process for me to lead the guidelines. It was great to work with members of the writing committee, some of whom I knew, some of whom I did not know previous to this effort. And I think that we're all proud of the document that was released. But I want everyone to keep in mind that because the body of evidence evolves so quickly, there will be an update to the ACS guidelines sometime in the next few years. And I want everyone to keep an eye out for that. So thank you very much.